Yes.
And we're going to stay public?
Yep. Just like the policy meetings are posted as public meetings.
Okay.
Right.
Anyone can attend. And now that we're doing the virtually, we have to. So I just
Do it this way. Yeah.
And we're going to stay public?
Yep. Just like
Yes.
the policy meetings are posted as public meetings.
Okay.
Right.
Anyone can attend. And now that we're doing the virtually, we have to. So I just
Do it this way. Yeah.
So the meeting is now live for you. You guys can go ahead. I'm just going to mute out.
Thank you.
Thank you, Ben.
Celeste had sent us an email and brought up a really good point that we may want to write this very general to say that students are to comply with all safety measures implemented within the plan, including distancing,
Right.
I don't know what following the one-way corridors, all the other safety things. So if we write it generally, and I've been thinking about it, I thought that somehow we could word it in that a first inadvertent violation will receive a correction and a warning.
Mm-hmm.
A second, even inadvertent or intentional, will result in a referral to the building principal for further action.
Mm-hmm.
Because some kids, say a kid goes the wrong way or goes within 6 feet of someone and it's just accidental, that's inadvertent, but that can't keep happening.
Right. Right.
So once a child is warned or told, I think then a second violation, then it needs to go to the building principal for
right. Maybe a call home or
right, and then they would determine it. I don't think we should get that finite where we're gonna, but I think we just have to have in writing that no, this is serious, like
right. So Diana, do you know from the bus company if any of their other districts, do they have policies pertaining to that about riding the bus?
They do not.
Okay. So to our legal staff, he felt like, he isn't developing one for any of the other districts at this point, but he said, he said that they're basically following the guidelines by the CDC or so forth. If we want to get down to actually having a policy, he said, whatever you guys come up with, he wants us to send it to him so he can take a look at it.
Okay.
And I know that Jessica had some information from, I don't know if it was from other districts, pertaining to, policies like this or wording that, she'd want to put in.
She had emailed something, but it was what she had sent me was more limited to mask wearing.
Right.
But I think if we write a more general policy with the seating on the bus,
social distancing.
Right. Include mask wearing, and then say that if the violation is inadvertent, it will be corrected.
Mm-hmm.
Well, not if, just say inadvertent. A first inadvertent.
A first offense.
Right. But I want to put it somehow like, I don't know if the word inadvertent would be, but unintentional. Like, I don't know. I can picture kids sitting in the wrong seat, or, it's going to take a while, and certainly kids are going to be punished for, or not punished, but not referred to the office.
It's Ben Russell is the owner of this because it's live. Let me tell him. Hey, Ben, Kathy says she can't get into the meeting. Well, mine too. I can never get my picture up. And I got it for a little while. Ben's on here, but hi, Ben, can you, we need to get Kathy into this. because there were two links done. The one that was, you need to go into the Zoom one, which was the second one that was done, because this was posted, it has to be a meeting, public.
Ben might have stepped away.
Oh, I apologize. You guys were talking to me? I had the volume down.
Oh, that's okay, Ben. Kathy says she's trying to get into this meeting.
Oh, I sent you the link. Let me,
She said it said it was waiting for the host.
Oh, you're right. Hang on. Admit all. Sorry, I'm a bad host today. All right.
That's okay.
Okay, I'm here now.
Oh, and here's Jessica.
Good
Oof.
morning.
Morning.
Good morning. Something's wrong with my thing. I can't seem to get my picture up, but I am here. So we were talking a little bit about, I know we wanted to, Jessica, a policy. I did reach out to Ben. He's not developing any right now for his other districts. He said they're following the CDC guidelines and so forth. But I told him we were looking at a possible policy, and he said, you know, we'll send it to him after, just to make sure whatever we come up is, you know, is legally sound. So-
Jessica, I had just
Everyone to realize this is a public meeting and it's streamed.
I wanted to talk about the email that Celeste had sent, which I appreciated, saying that we should write this in a very general, to include also other safety protocols that have been established, not just mask wearing, seating on the bus, social distancing, following the corridors, you know, the one way. But not, I personally think it should be something in general enough to say that all students and staff will abide by all new safety protocols implemented in the plans for reopening. First inadvertent violation will be corrected, because I can picture kids getting closer than 6 feet unintentionally, and it needs to be corrected, but that a second violation would then be referred to the building principal for further action. And then it would be up to the level in the building principal. What do you think? Is that too general?
What do you think, Jess?
Well, I agree. I agree that we write the policies and the procedures usually come.
I can't hear you.
I can't hear Jessica.
You're coming in and out, and then you freeze.
Yeah, she's frozen now.
I don't think this meeting was meant to be.
I don't either.
My connection is horrendous, and I apologize.
That's
I mean,
okay.
it's horrible. I just left the bus, so I'm really like not in a position, so I apologize. My point was, you know, we have always been the policy writers. We don't write the procedures of how the policies we have now, you know, principal empowerment. I think every principal is going to see this differently in their classrooms and in their schools. And I think if we write a general policy based on the governor's mandate, that covers us and in the safety of our students and our staff, I think that is how we have to look at it, in my opinion.
Great.
I think I agree.
Correct on that one.
Yeah.
I agree with Jessica that it's got to be a general policy, and then the protocols are done individually by either the the school or what the offense is on the bus, but she's absolutely right.
Right. I don't think a policy incorporates what the punishments or, or warnings are going to be. It's just, this is our policy. And then principal empowerment, they handle that and warnings, and every school is different.
The thing that I'm concerned,
Yep.
I know that when I taught at Riverside, bus drivers, principal, everybody has a different threshold of tolerance.
Right.
And some bus drivers would let kids slide. Warning, until, meaning well, wanting
I
to
know.
give the kids the benefit of the doubt, but we have to really instill in people this is, the consequences have to be immediate and succinct. I
Just so you know, Mrs. Oliveira, that
yeah,
with bus discipline,
Yeah.
we have curbed that quite a bit because, like you said, bus drivers, sometimes the tolerance level is different. Some will let it go just because they don't want to see the children get in trouble. But we've curbed that. I've changed that. Everything
good.
somewhat systemic, and it has to be continuous and consistent. So
Good.
yeah, so I think that as long as they're following the mandate, if a parent tells us, just like they would in school, that the child can't wear a mask on the bus, it's going to come from the parent, it's going to come from a medical documentation, and then we'll make certain provisions for them to sit in a different seat than maybe how we're going to load and unload. But I want you to sort of allay your fears a little that it will be consistent. It will not be a free-for-all.
Diana, have we got any requests from parents that kids who ride the bus that they can't wear a mask?
No, we have not. And I received an email from Statewide regarding and Statewide does more of our special ed transportation.
Oh, yeah.
So I'm working with Judy Antonio to come up with a list if in fact she feels that there will be an issue and having to talk with those parents. But for the most part, everybody, will be wearing one as far as I know.
Could you share with me what type of medical condition would prevent a mask, like asthma, things like
Yes.
that?
You know what? I can't really, that would probably be something from Cheryl because she's
Yeah.
been handling it for the teachers.
Mhm.
But anything that has any kind of a respiratory issue, breathing, like breathing, asthma, any kind of maybe swallowing issue, a student that may have some kind of a G tube or anything along those lines that I would think that could possibly be affected by the mask.
You're
Even if it's
absolutely
on their
correct.
face, if there's a problem with it slipping or whatever, that would cause any kind of problem with any of the apparatus that they may have.
Yeah.
Mhm. So the request that I have gotten with some medical conditions pertaining to upper respiratory, a lot of the doctors are writing, not saying that they can't wear a mask, but that they may at times need to have some frequent mask breaks. But
Oh, yeah.
we all need that.
Yeah, that's true.
I mean, for someone who wears one for 10 hours at a time, myself, it's up to 12 hours at a time. That's human nature.
Right.
It's human to have to take a cloth face covering off of your face at some point after 12 hours. I'm sorry to be that.
We're not going to be in these buildings saying, having someone be like, I need to take this off for a sec. I'm sorry, you can't,
Well, once again, I think that's where principal empowerment and personal, I think that's where we step out of the realm of this and we
That's
allow,
right.
that's why we have these individuals as administrators in buildings to make sure that they are taking care of their buildings, their students and their teachers. And
So-
if at that point, if we see that that's not being handled correctly, I guess the school department makes sure that their administration handles it. And at that point, I think the school committee then gets involved.
Right, because basically if you have a principal and you're saying, this is our policy, as vague as it may be, the policy could be one line, you must wear mask, blah, blah, blah. Okay.
Yeah.
And the people are not doing that. So the principal, what are you doing about this? You know, what's your guidance? How are you handling that in your building when that happens? Here's our policy. How are you making sure it's followed?
Yeah, that's true.
And
Yeah.
I think as our job as a school department is to make sure we send home information that says, this is our policy, this is what we are doing. And we are following the state mandate, which is to wear, I have no idea what is,
To stay
there we go.
6 feet, social distance, wear a mask when you're
Correct.
in public or around people when you can't maintain a social distance.
Yeah.
Correct.
Right. So it's the same guidelines, you know,
Well, and the only reason I'm being picayune about this is parents that I talk to, they like the plan, they read the plan, they're familiar with the plan, but they're saying that's on paper.
right.
Is it going to be carried out? And I'm fearful that, you know, people right from the beginning that they see that, yes, it is being, you know, I mean, I would question my kid when they came home. Did everybody have a mask on in your
Yep.
classroom today? You know, I would ask. And if they said no, I would be on the phone. Well, my kid's not going then. You know what I'm saying? I just want to make sure that parents of students who are following the rules are comfortable with the fact that others are as well. And if they're
Right.
not, that the administrators are addressing it.
Right. So if a child has a 504 and is indicating that they cannot wear a mask, we cannot force them to wear a mask. So these could be medically fragile children and issues to that effect. So, you know, when I get some requests for even, you know, people that are going to be in our building as educators and their accommodation, wanting their accommodation to be that every child needs to wear a mask and a face shield. Yes, we will do that, but not a face shield. They'll wear a mask. But if it becomes the point that someone has a 504, we'll have to figure out how to keep that person and that child safe. You can't say to that kid, well, we're sorry, somebody else has an accommodation that all kids have. You can't have an accommodation that involves other people's actions.
Yes, right.
Right.
Oh, this is hard.
Still dealing with, you know, a lot of this and the medical notes and so forth. So, you know, we're going through those. And when we get off this meeting, Celeste and I are going through every single 504 request that came in for staff. And we're going
Wow.
to answer them on what's reasonable and what's not.
Yeah.
And if they feel like some of the things that we cannot do are deal breakers for them, then they need to make their decision on whether or not they can be in the building.
Yeah.
Everybody has to make that decision.
Do we have a lot of staff that are unable to be in the building as of right now?
I would say a lot of them have been able to, based on the numbers with the students and staff and the need, some students that are distant, we were able to say, oh, this staff member is fragile, needs to stay out, but hey, now they're certified in this and we have a whole group of these kids
Oh, awesome. So they were able.
classroom. So that's what Sandy and I are at the point now. It's like, I'm letting her know based on my staff she's letting me know based on the needs of the students, and we're coordinating that so that, you know, we don't want to see any teacher have to stay home and not do that, but not every teacher will have this opportunity.
Sure.
Say, for instance, you're a teacher who can't come in and you have FMLA and there's no your whole class is going in person,
Right, right.
virtual opportunity, and you're not certified anywhere else where we need a virtual teacher. We're sorry, we can't offer that.
But
So
just the fact that you're working hard to try to
We are.
align everything else is awesome, because I know
Yeah.
other districts are not.
you know what?
Um,
Let's face it, right? No one signed up to be a teacher to do this. You know,
Right,
you know, if
yeah,
you become a nurse, you know you're in the front line. You're a doctor, you know you're in the front line of that. Teachers were never expected a situation like this. So I am very sensitive to that.
sure.
That's all I've worked on really all summer, is basically giving them information, making sure I have the proper information back. And, you know, and then sometimes with the 504s and the requests that the doctors are asking, I'll say, gee, we can do A, B, and C. There's no way we can do D. Is D
Yeah.
a deal breaker? If D is a deal breaker, I don't, you may need to talk to your doctor again about staying home.
Yeah,
Sometimes within that conversation, when they hear what we are able to do, they're, oh, that should be fine. And then I get a sign off from the doctor saying that that would be adequate.
oh, great.
Yeah,
Oh, great. That's awesome.
yeah. So, I mean, we hate to see anyone have to, you know,
Right, but
wrong
yeah,
time for this, but, you know, then it becomes a decision for each person based on what is safe for me. You know, it's like, if, you know, if you really feel that you're in jeopardy, you know, you have to be the adult to make the decision of, I can't take this chance, or I can, you know,
right.
that's individual personal experience decision between them and their doctors.
Right.
So Cheryl, I just want to go back to the fact that back in the end of July, the governor, along with the Department of Health, mentioned that they themselves were going to come out with a universal mask wearing policy for the schools. I have yet to see anything.
We have not seen that.
No, but I do want to make sure that everyone is aware. I did put it in the email to the policy committee. I did forward that information, that there was a quote that the governor and the Department of Health was going to come out with a blanket, their own policy for the school departments to follow. I have yet to see anything. I cannot find it on the Department of Health's website for any guidance of mask wearing within the schools, except that it's mandated.
Right.
But I would have preferred to have something a little more, you know, legal, because
So
as you know,
maybe our policy, as Celeste had indicated, can be as big as like what we're saying. You are required to follow the CDC guidelines and the plan for East Providence School, as well as wearing masks. I mean, I don't know if we wait until we get something from the state or we put something in vague. I'm fine to do either one. Whatever we decide to write, you know, I just want Ben Scungio to look at it.
I personally don't want to wait.
Okay?
I'd rather be general. And I think we could write something and he could tweak it if he had to.
Absolutely. So,
The way you just started it, I think is important, that all staff and students
mhm.
in the East Providence School Department will adhere.
To the CDC
But
guidelines.
I would say even before that, I would put would adhere to East Providence reentry plan, which is aligned with the CDC guidelines.
Yes.
Not aligned,
Right.
but what's the word I want to say? It's the
In
East Providence.
accordance like in
Yes,
accordance?
yes,
Yes.
yes, yes.
And then what about we keep it as vague as that, okay? And then we just do bullet points, mask wearing, maintain social distance.
But I'm afraid we might miss one. What if we just clumped it and said all safety, and
Protocol for re-entry. Or
yes, yes,
Okay,
yes,
so-
yes.
Yes,
So
I
here's what
agree. Keep
what
it-
if I
keep it
try
simple.
to, and if you guys have any ideas, then you want to send me a quick little email. And I'm going to be meeting with Celeste after this. And I was thinking maybe we could try to just kind of come up with something and I can shoot it out to you guys. And then we can all work from that document.
Yeah, could you read back? Did you write down what you just said before?
No, I just took this out of the top of my head.
Can we try to write that again? Can we try and write that?
Absolutely. So,
All staff and
students
students. All staff and students will adhere to the
East Providence
safety.
School. To the
Okay, yeah.
Re-entry.
school re-entry plan,
Or safety protocols.
safety protocol, which is in accordance to the CDC guidelines.
Perfect.
Okay?
But then I think we need to, and you could work with this with Celeste if you want. Somewhere saying, Jessica had worded it good, where violations will be handled
Handled, you know, with the,
at the building.
at the building level.
Yeah,
What do you think?
as
Diana?
appropriate. Violations will be handled, not handled, will be, I don't know, violations will be,
Can we use the word consequences? I don't like violations anymore.
okay. Yeah, you're right.
How about failure to adhere to these policies?
Yes, failure
Yep,
to adhere to these policies.
will be
Will
addressed
be-
by the
And
building
or
principal.
procedures.
What'd you say, Diana?
And or procedures.
Oh, yeah. Policies and or procedures will be, but I want like a word, not swiftly, but will be, I don't know, a word to imply like this is serious.
Will be referred for disciplinary actions by the administration.
Perfect,
That's good.
perfect.
That's good.
I like, can you read, who's writing that? I
I'm
wasn't
not writing anything.
Oh, shit.
Public meeting.
Oh,
Yes.
sorry. Cheryl,
Yes.
write this,
All right.
type it.
I was
Write it.
eating great. I was eating great. Sorry. Okay, let me do this. Write this down.
No, I think it was good.
Yes.
Jessica, did you write it?
Well, here's what I was thinking of doing. I was thinking of getting it down on an email and then sending it all to you guys in an active document that you guys can go in and make notes if you want to.
Okay,
That's a great idea.
So,
yeah,
so why don't I, when we hang up, I'm going to get that ready and send it right over to you guys.
okay.
Okay, so that'll give me time to I have two screens right now and I can't see myself on either one. So once I hang up, then I can go in there and type something out and get it to you guys.
Okay. I like how Diana added policies and procedures.
Diana, if you can send me quick little notes in email, just so I can incorporate some of those words.
Sure.
Thank you. And it's Diana's birthday today, so
I
happy.
know, happy birthday.
Thank you.
You're not supposed to work on your birthday.
Yeah.
I mean, especially when it's like your last year of your 20s.
Right?
29, girl.
Let's not over exaggerate. Let's say last year of our 30s.
Yes. All right. So what if I'm going to actively work on that and get that to you within the next half hour or so, working with Celeste. And then that way we'll have something we can all be able to type into that live doc.
Perfect. And then you'll forward it to Ben for
I am, yes,
review before we even, now, but we won't even be able to get this in
not this
before,
time.
for first read, right?
No, because it's not on the, I don't know if, no, it's not on the agenda. But you guys are having meetings almost on a weekly basis, right?
Yeah, I know, yeah.
So Jessica, you could ask to have that just added even next week's, just quickly if you want. Jess?
I will do so.
Yeah.
I will do so.
Because it's not going to make it this time. I think if we develop one, I think it's important enough to get to add it into one of our emergency, meetings, because it is pertaining to COVID and our reentry.
Could I also request that this policy, when it's not only just be added to the policy book, but could it be a separate document on the website? So that parents can see that particular one. Yeah, I mean, that we're addressing
Yeah.
the protocols, and that it's not just on paper, that we have a policy that all staff need to adhere to.
Yep. So separate document on the website, maybe in an area where we have like our reentry things and so forth.
Yeah,
Okay.
yeah, like a new policy or a COVID-19 policy development,
Okay.
whatever, and that first policy as a result of COVID, whatever, you know what I
Yep.
mean?
Yep.
Just
I
so
hear ya.
people know that we're addressing it, because that's the one thing I'm getting questions about, that there, just yesterday, a friend of my daughter's called me to say that she's very happy with the plan, but how can she be assured that that's going to be followed through? I said,
Okay.
well, the plan is our policy. It's what
Right.
we've approved. If
Right.
anything in the plan is not adhered to, then we're not opening.
Right.
So that's what they're concerned about.
So
And
that's
on
why I
paper,
think
it all looks good, but
yes. And that's why I think it's important when we write this to kind of circle right back into our reentry plan.
right,
Because that's kind of a less, it's not a Reader's Digest version. That's the long version of
yeah,
everything that we're planning.
yeah,
Policy will be short in basically saying, not following those guidelines. We'll refer to the principal for further action. or
Diana, do
however
you
we
think-
decide to work.
Diana, do you think we should actually put safety protocols and procedures for bus and school?
Yes,
Yeah,
yes, I do.
Okay.
Because
Yeah, I do
some
too.
students don't think that, like say, for example, their phone policy.
oh, yeah,
It's just it's an extension, the bus is an extension to their school day. So they're not
Right.
really supposed to be picking it up then. So the same thing would occur here, that it should be both in school and on the bus.
Okay,
thank you.
You're welcome.
that makes sense. I was hoping that Ben had a policy already done, but
I know. They might
Yeah.
use this one.
yeah, so he probably will.
Yeah.
Yeah, so anything,
No, and I think that's general enough, but yet specific enough to say they need to adhere to the plan.
right, because we circle them right back to that.
Right, and that anything, like Jessica said, not violations, but whatever, will be
Right.
handled at the building level. Yeah,
Will be handled at the failure to comply, or something to.
yeah,
I'll word it.
yeah, will be, I don't know, Diana had said a good, how did you say it, Diana?
She's gonna send it to me, Karen.
Okay, because she had a sentence there about failure to comply.
Yeah, so
Right.
failure to comply will be, how did I say it? In the event there is an offense, the individual will be disciplined by the proper administrator.
I think, I mean, it was to the point, like,
Yeah,
it made me feel comfortable. It was stern yet,
right.
yeah.
I'll have her try to send that, and once I get get Celeste over here, she usually is a pretty good wordsmith.
Yeah. Sounds good.
All right, ladies.
And you'll email it to us and we can tweak
I'm
it
gonna do
or,
that, and then Jessica, maybe for not this meeting, but the next one that we're probably gonna have
Yeah.
a week later, you can ask Sharon to add policy committee to that, and we'll put this one out there.
So I will definitely do so as soon as we have something in writing.
Yep, I'm gonna work on it as soon
Thanks.
as we get off.
how many reads do we have to do? 2, Jessica? Before it becomes,
We don't have to, we can, yeah, we can do a meeting whenever we want. That's the chair for a meeting. We have to
okay,
do 2 reads.
okay,
Right.
okay.
Usually the first read, and usually by the second read, unless there's additional issues, you could have the second read and then they can vote it,
Yep.
okay?
And then on the website, I don't know how you would head it, but I anticipate things coming up that we may have to write policies for, just for this situation.
Right, so maybe we need to, I'll check with Ben Russell about
Yep.
an area that is pertaining specifically to code.
Yeah,
So that, and that might be a good spot for people to click in there, and then anything you need added, just send it to the web team. Yep. So,
Yeah.
yeah, because then they can kind of click on something like that.
yeah, right, yep, yep,
Everything that's pertaining to this pandemic and things that were put into place.
yeah,
Okay, I'm gonna ask about that.
okay. Sounds good.
Okay. I'll be
We're
sending
getting there,
it later
lady.
today.
All right, thank you.
Have a good
Bye,
long weekend, everybody.
Thank
Have a
Yeah,
good weekend.
thank you.
Bye.
Oh, wait, one thing. I just want to say that the kids that helped out with the bus video did an amazing job. It was
That's awesome.
Seth
Thank
Bryn
you.
and Jericho Seals, Sydney Olson, and Ella Lowell, and they did a great job. So thank you again for those kids helping me out today.
Are you going to credit them, their names on the video?
Well, I don't know about that, but I will try. We'll see what Ben has to say about that.
Because there's not that many, right?
No,
Maybe
no,
he could do a credit page at the end with their names. That would be
That-
cool.
that would be.
Yeah,
I'll give them a heads up on that.
okay.
Thank you.
Thank
Thanks,
you.
everybody. Have a
Bye.
nice
you.
long weekend.
Yeah. Okay, bye.
Enjoy.
you.